My name is Daniel Welch. This is a head-to-toe assessment for Nursing 612, Maryville University. This is my patient, female patient, 24 years of age. She has emptied her bladder, put on a gown, and her vital signs were taken. Her vital signs are 114/68, her respirations are 14, her pulse is 58, and her temperature is 36.6. Starting at the top, noticing her head. Her hair is evenly distributed. Her hair is brown. She does have highlights in it. And as I palpate, she is normal cephalic. She has no masses or lesions on the skull. No dandruff in her hair. Very good. Is any of that painful?
No.
Very good. Now coming down, noticing the symmetry of her eyes and her ears. Her ears are symmetric and equal bilateral. Her eyes are also equal bilateral. Doing a light sensation, I'm going to have the patient close your eyes, and I'm going to sweep with this gauze pad. So just tell me if you can feel this.
Yes. Yes. Yes.
Very good.
Yes.
Very good. She could do the light touch on the forehead, cheeks, and chin. Now looking at her eyes, her eyelashes and her eyelids are full and free of abnormalities. We're going to do a visual field. Very good. Very good. Her visual fields are intact. Before entering the room, the patient did a Snellen chart confirming a 20/20 vision with her contacts in, but the patient does wear glasses when her contacts are out. Looking at her eyes, her conjunctiva is clear and her sclera is white. Doing those visual fields, no nystagmus was noted. Now I'm going to get my ophthalmoscope and just keep your eyes nice and open for me. Very good. Very good. Upon using the ophthalmoscope, she had bilateral red reflex. Bilateral optic discs are visible and flat with sharp margins. Her vessels were present without any hemorrhages. Cranial nerve 2, her optic nerve is intact. She had good pupillary response. I'm going to do just look at my light here. Her pupils are equally round, reactive to light, and I'm going to have you look at my finger, and then look at the wall behind my finger, and then at my finger again, and behind my finger. And her eyes are accommodating. Patient has pupillary response proving cranial nerve 3 oculomotor and cranial nerve 4 trochlear are intact. The 6 cardinal fields prove cranial nerve 6 abducens is intact. Now looking at her ears, I'm just going to switch to my otoscope now. Her ears are symmetrical. They're equally aligned bilaterally. I'm going to palpate your auricles, your ears here. Is any of this tender?
No.
Very good. Her auricles are pain-free upon palpation. I'm going to do a whisper test.
Knob, car, grass.
Very good. And on this side?
Happy, picture, car.
Very good. So her whisper test was 3 out of 3. Now I'm going to do a visual of her tympanic membrane with my otoscope. So lifting her auricle up and out slightly, I will insert Very good. On that left ear and then to the right ear. Up and out. Very good. Her tympanic membranes are easily visible, no bulging. She had good light reflex, minimal cerumen, no protrusion or retraction. Now I'm going to perform the Weber and the Rene test. So with this test, I'm going to place the tuning fork on the top of your midline of your skull, and you just tell me if you can hear the sound equally in both ears. Strike the tuning fork. Place it midline.
Yes.
She can hear it. Very good. Now on this next one, the Rene test, I'm going to strike the tuning fork and place it on the bone behind your ear. And when the sound goes away, you just tell me it's gone.
Gone.
Very good. So looking at my watch, I noted the time. Now, then we're going to do the air conduction test. I'm going to do the same thing, striking the tuning fork, placing it close to your ear, and then you again tell me when the sound is gone.
Gone.
Very good. And then again on this side. So first we're going to place it on the bone behind the ear.
Gone.
Okay. And then again.
Gone.
Very good. The Rene test was performed, proving air conduction is twice as long as bone conduction. Cranial nerve 8, acoustic nerve is intact. Now for her nose. Looking at her nose, going to again get my scope. Noting her nose is midline. I'm going to have you plug one nostril and breathe, and then plug the other one and breathe. Are they both easily?
Yes.
She can easily breathe through both of them. Alright, now I'm going to visually look. Very good. No deformities, no septal deviations, no perforations. With her eyes closed, with your eyes closed, I'm going to have her determine two different smells. And I have them in the form of candles. So here's the first one. Close your eyes. What smell is that?
Cinnamon.
Very good. Now continue to close your eyes. One more.
Pineapple.
Very good. And that is correct. It's cinnamon and a pineapple candle. Proving cranial nerve 1, olfactory nerve is intact. Her nasal mucosa was also pink and moist, and no deformities noted. Okay. Now we're going to do visual of the mouth. So I'm going to have the patient open her mouth. With my scope, I'm going to look in. Her buccal mucosa is pink and moist. All of her adult teeth are there. Let me see your gums. Her gums are firmly attached to her teeth. Very good. She does have some dental caries noted. She has had some cavities filled, but all of her teeth are there. I'm going to, with my tongue depressor, I'm just going to look into the mouth, and I'm just going to have you say, ah. Very good. As the patient says, ah, her uvula and her soft palate rise, and then now we're going to assess a gag reflex. With my, very good. Her gag reflex is present. Are there any sores in your mouth?
No.
Very good. So there's no sores, no issues there. Can you puff out your cheeks? Can you smile? Can you frown? Very good. So those are proving facial nerve, hypoglossal nerve, and they're intact. Okay, very good. Moving down to the neck. I'm going to look at thyroid and make sure everything's intact. So, looking at her neck is symmetrical, even on both sides. Here she's got good skin turgor rated at +2. I'm going to palpate. I'm going to feel you swallow. Very good. I'm going to have you move your neck slowly side to side. Are there any catching? Any problems doing that?
No.
Do you feel any catching when you swallow?
No.
Very good. Her trachea is midline. There's no catching present. No issues there. Can you lift up your shoulders just like that? Very good. And now relax. Very good. Shrugging your shoulders without resistance proves cranial nerve 11 is intact. Very good. So then we're going to do anterior chest, making sure everything is intact. Also that light reflex, able to puff out her cheeks. Can you clench your teeth? She can raise and frown and smile. That proves cranial nerve 7. Can you move your tongue? I forgot about these. Can you move your tongue? Up and back. Very good. By moving her tongue, that is glossopharyngeal. Patient can open her jaw and close her jaw, proving trigeminal nerve. And very good. I'm going to palpate lymph nodes on her neck and her chest here. So starting with occipital. Did you just tell me if any of this is tender? Occipital. Submental. Submandibular. Superficial cervical chain. Posterior cervical chain. Preauricular. Postauricular. Any of that tender?
No.
No tenderness or abnormalities noted. I'm going to check her pulses. Carotids is rated at +2 and equal bilaterally, and we determined that her spinal accessory nerve is intact. Posterior chest. Anterior chest. Nice couple big deep breaths. Very good. Noting her expansion is equal and bilateral. Now I'm just going to assess your back. I'm going to now assess her. Very good. Very good. Back and posterior chest. Thoracic configuration is symmetric. Very good. And I'm going to palpate and percuss any costovertebral angle tenderness. So I'm just going to lightly touch. Is any of this tender?
No.
And then now I will percuss. Any of that tender?
No.
Very good. Percussing costovertebral tenderness is absent. Now, with my stethoscope, I am going to auscultate respirations and breath sounds. Nice big deep breath. Very good. And again. Very good. And again. Very good. Nice big deep breath. And again. Very good. She has clear breath sounds, posterior and lateral lobes. Upon auscultation, I noted her rhythm was normal and her rate was unlabored. Her respiratory effort was smooth. She has equal posterior and lateral chest expansion. Repeat the words 99.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99,
One more.
99.
Very good. As I palpate in a Z back and forth pattern, no tactile freminess was noted as the patient repeated the words 99. Now I'm going to assess for diaphragmatic excursion, percussing along the scapulary line, finding the dullness. I have a marking pen, so just normal breaths here. And I'm going to start percussing. Okay, noting where it changes to dullness. Now I'm going to have you take a big deep breath in and hold it. Okay. Placing my finger on the spot, I'm going to mark it with a skin pencil. Now take a few, you can exhale. Take 1 or 2 breaths to catch up, and then we'll repeat the test when you exhale. Noting a change in dullness. My marks are consistent with previous assessments. Now you can breathe. I'm going to do the left side, so take a couple big deep breaths, just nice and normal. Okay, noting the dullness, inhale and hold it. So breathe, good, and hold. Noting a change into dullness, I mark it with the pen, breathe. A couple breaths to catch up, and then exhale and hold. Again, noting a change on that scapular line, making marks with my pencil. Breathe. Using a tape measure, I'm going to measure the distance between the marks that I made on her back. On the left side, it is 5 centimeters. On the right side, it is 4.9 centimeters, consistent with previous diaphragmatic excursion assessments on this patient. Breath sounds are clear. No wheezes or crackles were noted. Now I'm going to have you turn, and we are going to do an anterior chest evaluation. So coming down, anterior chest, noting skin turgor. Her skin is pink and moist. There's no visible lesions or any abnormalities. Watching her breathe, her chest expansion is equal. And I'm going to listen for breath sounds, and then we will do heart sounds. So just take nice, normal, deep breaths. Very good. Very good. Nice, big, deep breath. Very good. Her anterior and lateral breath sounds are clear and equal bilaterally. Now I'm going to do heart sounds. I'm going to do pulmonic area, aortic, Erb's point, tricuspid, and mitral areas. Listening for S1, S2, as well as any murmurs or gallops or friction rubs. Alright, pulmonic. Second intercostal space. Nice big deep breath. Very good. Erb's point. Third intercostal space. And a little more medial. Very good. Aorta. Very good. tricuspid. And then mitral. I'm sorry. Very good. Whoops. Her heart sounds are even S1, S2 are all clear. No friction rubs. No murmurs or any abnormalities noted. Now I'm going to inspect the abdomen, so I'll have you just lay back. Very good. We'll just lift up the gown. Again, keeping the patient comfortable and modest. I have a towel here placed. So first, looking at the abdomen, the patient has had 2 successful pregnancies, so there are evidence of stretch marks, but nothing looks abnormal. Everything is normal. The skin is pink and moist. Very good. I'm going to now listen. I'm going to listen, auscultate for bowel sounds, as well as arteries, aorta, renal arteries, iliac and femoral arteries while I'm auscultating. First, bowel sounds. All 4 quadrants. Very good. Alright, bowel sounds are active in all 4 quadrants. I am auscultating aorta and renal arteries. Aorta was midline. Renal, iliac arteries, just near the umbilicus, a little distal, and then femoral arteries. Very good. Upon auscultating arteries, nothing, no bruits were noted. Now I will do a light palpation and then a deep palpation. All right. So light palpation. No masses noted. I'm going to percuss all 4 quadrants, listening for tympany or dullness. Is any of that tender?
No.
Nothing tender. Very good. Tympany to percussion in all 4 quadrants. Going to percuss the tone of the liver borders. So just breathe normally. And then spleen dullness. Very good. Percussing. No pain upon light palpation. Now deep palpation. Right costal margin for liver border. Nice big deep breath. Very good. Left costal margin for spleen border. Very good. Midline for aortic pulsation. And abdominal muscles. Is any of this tender?
No.
Very good. No hernias noted. And no pain upon deep palpation. Very good. I'll have you sit up. We're going to do extremities, upper extremities. Our arms are equal. Skin is pink and moist. Or skin is warm. Does any of this hurt?
No.
No pain upon palpation. No atrophy. No edema. I'm going to have you make a fist and hold in. And push out against me. And push in against me. Squeeze my fingers. Very good. And then hold your hands like this. And then go up. Awesome. And then down. Very good. Her strength is rated 5 out of 5. Her lower extremities. Her skin is pink and moist. No edema present. No swelling. No joint warmth. Her legs are shaven. Patient shaves her legs frequently, so there's no hair distribution. Very good. Muscles are uniform and even bilaterally. No pain.
No.
No pain upon palpation. Pulses. Since I'm here, we will do dorsalis pedis and tibial. Both are rated at +2. And again on this foot, dorsalis pedis and both are rated +2. We're going to do radial on our upper extremities. Rated at +2 on the left, +2 at the right, equal bilateral. We're going to do brachial pulses. Very good. Very good. Tibial pulses, dorsalis pedis, radial and brachial, all rated +2 and equal bilateral. A neurological function, we assessed cranial nerves previously. Patient can easily differentiate between smells and sensations. I'm going to have you close your eyes and put your arm out to the side, close your eyes, and then touch your nose with your finger, and then go back, and then, yep, other arm. Very good. Patient has full range of motion. Her muscle strength is 5 out of 5 throughout. Now with my reflex hammer, we will assess reflexes. First will be the knee reflex. Just let your leg relax. I'm going to find a spot here. Try one more time. Just let it relax. And then this one, just relax. Maybe scoot out just a hair. Just relax. Alright. And then Achilles. Just relax. Let your foot just hang. Alright. Achilles and knee reflexes are, deep tendon reflexes are +2 and equal bilaterally. Alright, we're going to do one here. Just let your arm dangle. And then again on this one. Nice. Okay. Deep tendon reflexes are all +2 and equal bilateral. Patient's gait is normal upon entering the room. I noticed that her gait was normal. This concludes our head-to-toe examination for an adult. Thank you very much.